This poor little pug was playing with its roommate or scratching itself, and somehow its eye came out of the socket. Very common in pugs and bulldogs, and can be a really serious emergency. But you can see this little pug's moving his eye around and his pupils constricting and reacting to light. So if you saw that in your dog, you could get a piece of gauze with a little saline in it and press on the eyeball, and until you get to the veterinarian. You don't want to press too much pressure on it because it may damage the sensitive eye. But in this case, when I put pressure on it, the eye went back into place. But see right on the corner there is where she pawed it and pushed it out on her own. But right now, the eye is actually in very good shape. Looks a lot better than when I first filmed it, doesn't it? Aren't you glad? I don't think she has to go through surgery to replace an eye that's popped out if it's not popped out any longer. Putting the green stain in, and you can see how the stain accumulates there in the lower lid, but we're looking for any kind of green stain on the eye itself. A piece of gauze and wipe away some of the other stain, like this, and look for any green stained areas, which we don't see, but we see a real red area. So as long as it doesn't stain green, like there's a scratch on the cornea itself, then we can use some cortisone ointment. And can I get some NPD?
Yes.
Look at how your eyes bugged out. You're just so scared. You don't want to stay. Where's mommy and daddy? But your eye was bugged out and you didn't know what to do. Popped out. So we're going to put some cortisone ointment in there. That will also take down the swelling, and we're going to put that in 3 times a day. And I think you can go home. My intent was to show everybody how to replace an eye in the socket under anesthetic using a suture pattern on the eyelid. That's the normal way we put an eye back into the socket for these little pugs and bulldogs and keep it there for a couple weeks, and then we can take the sutures out, and usually the swelling has gone down enough to where the eye will seat back down in the socket like it's supposed to. But this little cooperative pug actually decided to let me put the eye with very minor pressure, put the eye back in the socket, and just a little bit of pressure got it around the eyelids back into the socket, and looked like it was going to just stay there. So we didn't need to use anesthetic and surgery to suture the eyelids over the eye and put it back into place. I gave it a shot of cortisone under the skin, dexamethasone, steroid to reduce swelling, and I'm using a steroid antibiotic ointment in the eye 3 times a day to make sure the swelling stays down and the eye will stay into place. Well, I hope you enjoyed seeing that little scary episode. It was a busy day. It's kind of an erratic video, but hopefully it shows you what can happen. And I didn't mention when I said put gauze on the eyeball, you can actually just put your fingers on the outside of the eyelid or a gauze with warm water on the eyelid itself and use real gentle pressure to push the eye. Most times that won't work. There's too much swelling and the eye won't go in on its own. But anyway, if you have a chance, go to my website, Dog Dish Diet. Wrote a book called Dog Dish Diet, Feed Your Pet to Avoid the Vet, and also a new one coming out called the Dog Diet Answer Book, which should be out in May. Have a great day.